This program is paid for by Your Radio Doctor, LLC. All opinions or statements expressed on this program are solely those of Your Radio Doctor and their guests and do not reflect the opinions of WPHT or Odyssey. Your Radio Doctor does not recommend or endorse any specific tests, products, physicians, procedures, opinions, or other information that may be mentioned on Your Radio Doctor. Always consult your own physician.
Good afternoon and welcome to Your Radio Doctor. I'm your host, Dr. Marianne Ritchie. Happy Valentine's weekend. It's also Heart Month. A good time to reflect on your own numbers, your weight, your cholesterol levels, your blood pressure numbers, the minutes of exercise you perform every week, and the need to learn CPR. Well, today, CPR is more important than ever. And for the month of February, we're also working with the American Heart Association on their campaign called Go Red for Women. Here with us today is an ambassador from the American Heart Association, Stephanie Austin. Now, my regular listeners know that every week we highlight your real champion, a person who has overcome adversity with true courage, who does great work in the community. And Stephanie Austin embodies both. So she is this week's real champion. And our other special guest is Dr. Helene Glassberg, a cardiologist, a professor of medicine in the Perelman School of Medicine at the University of Pennsylvania. And she's also the director of the preoperative cardiac clinic and the board president of the American Heart Association of Greater Philadelphia. So I welcome you both.
Thank you.
Thank you.
And I welcome our friends here from the American Heart Association, Trish Bradley and David Plazak, who have really been a great help in coordinating today's show. So Stephanie, we begin with you. You're a real champion, our real champion. Bring us back to that beautiful summer night, 2008, Phillies. Did they win that night?
I would not know, to be honest with you.
You went to the Phillies game, came home, went to sleep, great night. What happened the next morning?
Well, everything I have to share with you about the next morning and the following 3 years are really a recollection of other people's memories because I have none from that time period of my life. I was 35 years old then and in great shape. I am a mom of two. At the time, the boys were 4 and 7. And I've always been an athlete, so very fit and played on multiple soccer teams. I even played with men. I played co-ed ultimate frisbee. I lifted weights. I just started taking tennis lessons for my future self. I didn't require a lot of sleep. I didn't think I needed a lot of sleep at the time and was just go, go, go until everything just stopped because that night after the Phillies game, I went to sleep and I suffered a cardiac arrest in my sleep. Fortunately for me, my husband, Matt, who is also a surgeon, received a phone call from a resident asking him what was really a silly question at 6 a.m. that Sunday morning. And that woke Matt so that he was awake to hear me take what would have been my final breath. So
And I really emphasize, I've gotten to know Stephanie in recent years because we've spoken before and I had her as a guest on the show before, but you are the embodiment of gratitude. I hear a lot of people have taken care of, as Helene, Dr. Glassberg, we've taken care of so many patients, and attitude makes such a huge difference. You are just positive Patty, and because you're grateful. And I think that's what separates happy people from unhappy people. But you already used the word fortunately. You've seen the positive, and we're going to talk about that in a minute. But so you go to bed, it's a great night, and Matt, orthopedic surgeon, gets a phone call, probably thinking, oh man, couldn't have waited another hour at 6 o'clock. And he hears a funny noise, he sees you, he realizes you're breathing irregularly, and what does he do?
Well, he called my name. I didn't respond. When he rolled me over, he saw that I was blue. My pupils weren't reacting. So he did exactly what he needed to do in that moment. He called 911. That's always the first step. And the next step in ensuring that I'm here today was that he initiated CPR. And how lucky I am that he did. And he maintained the CPR until the medics arrived. And even though I didn't regain consciousness and he, wasn't able to necessarily get a pulse back, what he was able to do is maintain the blood flow to my organs to keep my organs alive. And that's why I'm able to be positive Patty and be here today. Because without that step, I know for certain I wouldn't, because cardiac arrest is 100% fatal without intervention. And 90% of people who suffer a cardiac arrest outside of the hospital do not survive. So I'm in that 10%. And to be as functional as I am is really a miracle. And I'm just very, very fortunate.
And I think you see that as a miracle, and we all look for a purpose in life. But you, I've heard you speak before, and you take the word miracle and just absorb it. And what have you done with your miracle?
You know, if you are fortunate enough to experience something like this and have the support needed to recover from something like that, which I did, I think the only path forward is to pay that gift forward. And so I have, it was really difficult initially. The recovery, I would say the emotional recovery was probably even more difficult than the physical recovery. And you are stripped down to your most vulnerable after something like that. I went from being able to play a 90-minute soccer game to not being able to walk one block. And I was 35. So that was quite a thing. And I had, and I still to this day have memory issues. There are 3 full years I don't remember. And my short-term memory is no bueno. So it would be difficult for me to hold a traditional job because of that. But what I have been able to find is a purpose and a passion within the American Heart Association. They've given me a platform to share so that I can empower and educate other people. And my husband and I created a campaign called Faces of Heart for other women that struggle with heart disease and stroke, so that we can not only support one another, but also if they also want to join me in this path of stewardship and being an ambassador, that we can do that together. Mm-hmm. And I'm lucky because they have invited me into several leadership positions. So I've met some of the greatest and most talented, giving people like Dr. Glassberg sitting next to me. So it's been, honestly, it's one of the worst things imaginable, I think, that I experienced. And yet it brought me to the best place in my life. And I wouldn't be where I am were it not for that event. So,
well, and I think, too, I guess it's a way that I make myself get through hard days or hard times. I think to myself, going through something on a scale of 1 to 10, on a 1, when you go through a 1 or a 2, it makes that 10, when it happens, the rare 10 seems so much more special. I'm happy to live in the 5, 6, 7 range. I'm thrilled to live, but that was a really tough one. And the way you've turned it around, and the American Heart Association with your campaign, mm-hmm. and now you are the Woman in the Red Dress Go Red campaign. Tell us a little bit about that.
Oh, Go Red is just such a special campaign because it really highlights cardiovascular disease and stroke in women. And that is something that it is affecting more and more women at younger, earlier stages and ages of life. Women were not historically included in a lot of the studies. So a lot of the things that we are learning about are fairly recent. And when you hear that 80% of cardiovascular disease is preventable, that means we can do a better job than we are doing. But you have to know better to do better. So a lot of what Go Red tries to do is really to empower women, especially not only as the caregivers of ourselves, but very oftentimes the caregivers for their whole family. And we are in positions of power. So instead of looking at ourselves as victims, for example, I have a genetic predisposition to this. My son also has cardiovascular disease and also has a defibrillator and pacemaker preventatively in his chest. And listen, I can't do anything about that. I can't change that, but I can control the controllables. So that's what I'm working on. And to the point that you made, attitude counts for a lot. So I love the Go Red campaign in that it really aims to empower and enable women to improve their lives, improve the lives of their family members, and even as you referenced earlier, something as simple as hands-only CPR, which can very easily save a life.
It's a start.
It's something.
And we're going to talk about all those fine points, but a couple of things that you mentioned that you were down, memory, all those things gone. It had to take you quite a while to come back and rehab, whether it's after a knee surgery, rehab after a cardiac event is so vitally important. We can talk about that a little bit later too, but whenever we have a medical condition, there's primary prevention, finding it before it presents as sudden cardiac arrest. Wouldn't that be nice? But we don't know, if you don't know your family history, that there were people who died, just keeled over and died at a young age, or drowned and it shouldn't have happened, or they fell asleep at the wheel. Those things are important, and we as care providers have to think to ask those questions as well. So there's primary prevention, knowing that there's a problem and jumping in and doing the hard surgery or giving the medication. And then secondary prevention is, all right, this has just happened. I have to be ready to do this.
Yes.
And it's a big combo. American Heart Association is out there day after day trying to educate the public, and beautiful initiatives, Go Red for Women. And your program, again, that you started with Matt, your husband.
Oh, the Faces of Heart campaign. Yeah, we launched that a few years ago. And at our luncheon in May, we will be highlighting, I think we have 19 local survivors that will be highlighted. And they are nominated, and then they become my heart sisters. And I stay in touch with them, and we offer support to one another. And if they choose, they can join me and as an ambassador and work alongside the American Heart Association and Go Red for Women.
And I want people to visit the American Heart Association website and offer their time, talent, and treasure. Donations are always acceptable. And again, you give credit to the American Heart Association, everybody who's ever helped you, but it was CPR and defibrillator, which you wear proudly,
Yes.
that were both from funding that led to research from the American Heart Association. Yes?
I say it all the time. I would not be alive without the American Heart Association, because it is their funding that created the CPR, and it is their funding that created the research for the defibrillator that lets me live with some sort of peace in my mind. So I owe them, and my husband, I got to give him credit too. I owe them both a great debt, and it is my honor to volunteer for them.
Well, think of your baby boy. I mean,
Yeah.
hopefully he will avoid any sudden cardiac arrest when he's hiking in the woods, and
Well, and this is why knowledge is power, right?
Yes.
As soon as he was, you know better, you can do better. When I did not know I had a family member who died in her 30s of a cardiac event.
you found out that
I found out after a few
Yeah.
years after my cardiac arrest, but my grandmother's sister died suddenly in her 30s, and they only said she died of a broken heart because no one knew back then. So my boys were checked every 3 years, and my son was 7 at the time of my cardiac arrest. He was checked every 3 years, and it was not until he was 19 that he presented with
Wow.
cardiomyopathy, at which point we had him tested and preventatively had a defibrillator inserted in his chest in case, God forbid, he ever had the cardiac arrest. And now my other son gets checked every year. We're not doing every 3 years anymore. We're doing every year because, again, know better, do better. So
and it's just not that hard. A cardiogram,
No.
maybe an echo, easy capeasy.
Exactly.
And we always name our weekly champion, and instead of Peg of my heart, I'm going to call this week's champion Steph of my heart. So thanks for being here, Stephanie.
Thank you.
Wonderful, beautiful story, and you are an incredible inspiration to everybody who knows you.
Thank you so much.
thank you for being here.
Of course.
Let's take a little break, and we'll be back with more on Your Radio Doctor and sudden cardiac arrest in adults. Welcome back to Your Radio Doctor, and a very special thank you to both of our guests. But Stephanie Austin just shared her beautiful story of her appreciation for being here with us today, because her dear husband worked by reflex to save her life with CPR. We can't stress enough this month of Valentine's and month of heart health to learn CPR. So, Dr. Helene Glassberg, I want to ask you to take your jacket off and show us that awesome
you
shirt.
got it.
Okay,
It's really
you ready for
important.
this?
Well, I say Go Red for Women. I do also say Go
Okay.
Birds.
So can you stand up and show us that? I mean, it's really worth a look,
Yes.
because we have the Go Red for Women And we
then
have
go
the
birds.
birds on the back. Okay.
Love it.
I bleed
So-
green and red.
Something that we hope none of us, well, not ever, we can't prevent everything. As we said, there's primary and secondary prevention. Sudden cardiac arrest. I think a lot of people think that it's from a heart attack. It's not always from that. In fact, Stephanie's wasn't from a heart attack. She was 35 years old. Let's talk a little bit about the causes.
So you said the most important intro to that is that most people think that sudden cardiac arrest is a heart attack. And while most of the time it is due to the same mechanism, a blockage in the artery that can cause heart attack, or what we call ischemia, a blockage that limits blood flow, not always. So it's important to distinguish that sudden cardiac arrest is generally due to total stoppage of the heart due to arrhythmia. And that arrhythmia can be generated from a variety of mechanisms. The far and away most common is indeed a blockage in the artery causing either low blood flow and what we call ischemia, which can cause something like angina, or a complete blockage, which can lead to a heart attack. But other mechanisms are at play, such as cardiomyopathies, and cardiomyopathy can come in a variety of forms, and it generally means pathology of the heart muscle, some disorder of the heart muscle. That can be an enlargement, that can be a thickening, that can be just failure of the pump function, or a combination of the three. And just that disarray of the normal structure of the heart can lead to an arrhythmia and lead to cardiac arrest as well.
And then there's some non-cardiac causes. We will be talking next week about sudden cardiac arrest in children, and not quite as often, but sometimes it's respiratory, asthma attack, and there's lack of oxygen, and then their heart just stops, or if they vomit, anybody can vomit and aspirate in their sleep, something like that. But I was interested, I was trying to read up on this before today. Non-cardiac causes, trauma, but I guess that's if you are bleeding heavily, there's no blood to pump around, so bleeding. Drugs, certain drugs, intracranial hemorrhage. Is that because there's a center in your brain that signals the whole process?
Yes, the regulation feeds on one another. So yes, these non-cardiac causes are important because for either the dysregulation, such as the bleed in the brain, or direct injury, or even indirect injury to the chest, as well as asphyxiation or choking, where you don't have oxygen and then oxygen delivery is depleted to the heart as well. These can all trigger arrhythmias. There is one other primary cardiac mechanism that can't always get detected unless you take a good family history and or a cardiogram, but that is a primary arrhythmia due to a electrical disturbance. So there are hereditary and non-hereditary things that can cause electrical disturbances without the heart itself being abnormal.
So if everything's in good shape in your own heart, we have a natural pacemaker that tells our heart to go lub, dub, and with every cycle of lub and dub, blood comes in and you dub it out. That as soon as that machine is working, the blood's flowing to your head and to the heart itself and kidneys. But if something throws it off, like Damar Hamlin, we talked about that, he was a healthy, and still is healthy, thank goodness, but he didn't have any congenital heart abnormality. He didn't have a propensity to have an irregular heartbeat because of his own pacemaker wasn't cooperating. He got hit in the head at the exact right moment, hit in the head, in the chest, with another football helmet, or like a baseball catcher could be hit in the chest, or a trauma, somebody working on the assembly line. If you get hit in the chest at the exact right millisecond and it disrupts that electrical impulse to go lub-dub, it can send you into cardiac arrest, yes?
Yes, that's exactly right. There's a fancy term for it, commotio cordis, but that's exactly what that fancy term means, is that the injury strike occurred right in the moment of that cardiac cycle where it's sensitive to re-triggering and setting off a dysrhythmia.
So commotio, I guess it means commotion in your cordis, cord, I guess Latin for heart. And so when people get upset and say, why wasn't he screened? He had a normal heart. You can't predict that somebody's going to react that way to a hit. But we do want to, with the American Heart Association, really get out there and screen not just children playing sports and having their pre-participation physical before the fall sports or spring sports, but all children. All children run around in the schoolyard, run up and down the playground and all that. All children are at risk and need to be screened. That's the dream of the pediatric cardiologist from Children's Hospital. So the first steps in resuscitation, you see, you act. Tell us about that.
Well, as Stephanie pointed out, and she teaches CPR, so she can jump in with me as well, but as Stephanie pointed out, out, the first most important step is someone call 911. So while you're getting down on your knees ready to initiate CPR, someone call 911. If there is an AED or a defibrillator in the facility, someone grab the AED, and then down you go onto your knees. For hands-only CPR is now the recommended mechanism, except for kids. So kids should still receive the breaths, mostly because a common cause for a child to arrest is asphyxiation or choking. But hands-only CPR means start right with the chest compressions, rapid.
And you can go on American Heart Association, I'm sure, penn.edu, and find videos how to do CPR. But treat yourself. It's maybe a 2 or 3 hour commitment, and you're not expected to be, a cardiac surgeon. Anybody could do CPR.
That's one of the most important points. One of the biggest reasons why people don't do CPR is because they are afraid they won't do it properly. You can't do it wrong. If you watched the 1-minute video on the Heart Association, you could only do right. The person's dead. You can't hurt them. They're already as hurt as they can be.
You can't make someone more dead. And people are like, well, what if I break a rib? Yeah, bring it on. As someone whose life was saved from it, bring it on.
That means you're pumped hard. And do it on a hard surface, I guess. You don't want to do it on a bed.
Preferably on a hard surface. The depth is supposed to be about 2 inches. It should be hard and fast, 100 beats.
Staying alive.
Staying alive.
Bee Gees
Staying
fans.
alive. To the beat of the song, it's fast and deep. And, not to be flip, but we do say, if you break a rib, good
You're
for
doing
you.
it well.
That means
Bring it
you're
on.
doing it right. Yeah.
So we talk about the Go Red campaign for women. It doesn't mean we don't care about men. It means that aside from women being the nurturers, and I'm not, we do take care of our elderly parents and as my Aunt Kitty would say, our bratty kids. I love my kids. And my precious husband and all those good people in our lives. Women probably say, well, that's a little heartburn. Maybe they don't recognize their symptoms, or I should have said redneckize. That's what Honey Boo Boo says, and it's red. Okay. So we have to recognize the symptoms, but also, do providers sometimes, is it thought to be more of a man's disease?
Yeah.
The heart attack type, not the
is-
congenital, yeah.
This is a really important point because you're right. It's not because we are liking women more than men when it comes to this Go Red for Women campaign. It's because in 2024, women are still disadvantaged when it comes to heart disease in many ways. They still suffer more complications and death from their heart attacks. They don't recognize their symptoms. They don't get treated as aggressively as men. And it's because it is still, both in the eyes of women, their families, and doctors and nurses, a man's disease. So we need to change that up. And it's not just a man's disease. Women think that breast cancer is their number one threat to their health. But indeed, it's actually, in this country, it is far and away heart disease.
How do symptoms differ in men from women? Because they still, in men and women, chest pain's numero uno, yes? Isn't that still the most common presenting symptom?
Yes, so chest pain, chest pressure, the elephant on the chest. As I say often, women did not read the textbook as much as as men have. And so they tend to have different symptoms sometimes. Still, the most common is the chest discomfort, but women can get nausea, they can get a sensation in their throat, they can have shortness of breath and just a feeling of unwellness.
So 2 things. You talked about CPR in adults, and what would you say, maybe 10 years ago, we got away from the breaths and we said, just pump, 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 pump. Except, as you say, in children, especially under 1 year of age, but drowning, if a person has been involved in a pool. Real quickly, I love to digress, but I was talking to a pediatric cardiologist recently who said that some people, when they go into a swimming pool, if they have the propensity to have electrical abnormalities, that the cold water, or is it chlorine, is that a scenario that puts them at risk?
Yes,
sometimes?
some people that have a predisposition for electrical disruption and arrhythmias, one of the precipitants can be cold water immersion. Yes.
Tell me.
Well, that's me.
Duh.
So I do have so I have cardiomyopathy, and I also have an arrhythmia. We discovered the arrhythmia first. We discovered the cardiomyopathy.
So wait, excuse
a
me.
few years
So
later.
did your abnormal rhythm lead to the cardiomyopathy? Are they true or unrelated? Who knows?
We don't know.
Yeah.
I would love to know, but so my son has cardiomyopathy in the absence of arrhythmia. My arrhythmias began in college, but we thought they were very typical common arrhythmias. So really didn't pay much attention to them. And then when I was diagnosed with cardiomyopathy because of a preoperative clearance, I was active at such a high level that it really was somewhat dismissed again because I was supposedly
You were playing tennis and you were lifting weights and all that.
And I seemed fine. But my husband did a cold plunge not that long ago, and we both discussed how there's no chance in heck that I would ever be doing that because I also won't get into a sauna because I think any extreme. If you are susceptible to arrhythmias, I believe puts you at a greater risk.
So again, if we find a family history of somebody drowned at a young age, perhaps it was the cold water effect that set them into it. Who knows? But I mean, it's worth asking those specific questions when we find somebody who has a propensity. What do women need to know about their risks? Are they different than men's risks?
Yeah. So as I mentioned, the number one reason for cardiac arrest is blockage in the arteries of the heart, which causes heart attack too. So when we say heart disease, in general, most of the time, we're talking about blockage in the arteries because that is the most common mechanism for all the things that we're talking about here tonight. Cardiomyopathy and enlargement of the heart or failure of the heart, as well as dysrhythmias. So blockages of the heart generally is what we're talking about. That's due to plaque. So the risk factors that we're talking about for plaque buildup include high cholesterol, diabetes, really important one, tobacco use, family history, obesity, sedentary lifestyle, and high blood pressure. So I always say, know your numbers. Those risk factors are the same for men and women. They can be disproportionate. Tobacco is a big one for women. It probably weighs in heavier for the risk for women than men. So high on the priority list, quit smoking. But as Stephanie mentioned, 80% of heart disease is modifiable or preventable, and that's because all those risk factors can either be prevented with lifestyle or treated with medicines. So 80% of it really is preventable if you, quotes, know your numbers.
Pay attention and speak up when you have symptoms. Don't wait to be asked. Quick question, we have about 30 seconds. The coronary calcium count, it's a CAT scan, low dose, and we can get an indirect look at the arteries and see if they're plaquey or not. When is that a good idea? Family history or somebody has high cholesterol?
The most useful way to use that test is when you can't decide if someone's already either really low risk or really high risk. You kind of know whether or not you should be treating them aggressively with medication, say for cholesterol. But it's those folks in the middle. So the people that you're not sure, you're on the fence, they're at some intermediate risk and you'd like some additional information. That's where it falls in as most useful, is to determining whether or not that person has any calcium. If indeed they do, they're likely to benefit from more aggressive treatment. And if they have none, you might continue with lifestyle and reassess.
So I can go back to eating candy if I have a decent, which I still kind of do. Let's take a little break. Valentine candy. Just this month, you're allowed to eat candy. It won't hurt you. Let's take a little break and we'll come back on your radio doctor with Dr. Helene Glassberg and Stephanie Austin. Welcome back to your radio doctor with Dr. Helene Glassberg from Penn Medicine and Stephanie Austin, a mega ambassador for the American Heart Association. Helene, we were talking about causes for sudden cardiac arrest in adults. They might be a little bit different than in children. And people think heart attack, that's the only reason why your heart can stop and cause you to die. What are the other causes? Let's talk about Stephanie's a little bit without getting too private. Just cardiomyopathy. Cardio obviously refers to the heart. Myo means heart muscle. Pathology means the muscle's either floppy and it's not strong and doing its job of pumping strongly. It's kind of weak and floppy, and it can shiver or quiver, and then it's not going to pump out the amount of blood it should if it's doing a good bench press. Yeah. Pretty good analogy?
Yeah, that's a perfect analogy, actually. And I'll just reiterate something you led in with, which is, well, most people think that's heart attack. That disease, that coronary artery disease, or what we call ischemic heart disease, is still accountable for about 80% of cardiomyopathy. So still the number one mechanism for both sudden cardiac death and cardiomyopathy and heart failure and the arrhythmias. So all encompassing, and that's why we kind of hit home over and over, know your numbers, know your risk factors, because that indeed accounts for 80% of them. But there are many cases, just like Stephanie's, where the cardiomyopathy has nothing to do with blockages in the arteries or plaque in the arteries or ischemic heart disease, but rather a disarray of the heart muscle, something that affected the heart muscle. And that comes in a variety of forms. It can be something that has caused the heart to enlarge, a dilated cardiomyopathy, and that can be from a toxin, from a variety of mechanisms. It can be hereditary. There's a thickening of the heart muscle that can be, again, hereditary, such as hypertrophic cardiomyopathy, or something that infiltrated the heart and made it thicker, like amyloidosis. And then again, you can have just a primary heart failure. It doesn't necessarily have to be dilated or thickened, but weakened, a weakened heart muscle. Something weakened the muscle. And all these things can lead to cardiomyopathy. Not everybody has symptoms. So that's really where Stephanie's story hits home, right? She didn't have symptoms till she had a cardiac arrest. So knowing risk factors, having an understanding of what cardiomyopathy is, and importantly, knowing your family history can sometimes lead you to find the diagnosis before you ever present with something like arrhythmia or heart failure clinically.
I would like to chime in on that only
Please.
because I had not known prior to my cardiac arrest that we had a family history. And had I known, despite knowing that I had an arrhythmia, although we didn't know that it was a deadly arrhythmia at the time, I was still quite active. And then we found out I had cardiomyopathy, but because I was asymptomatic, we chose, we didn't do anything. There was really no appreciable change in my life. Had I known at that point, or had my medical team known at that point, that I also had a family history of sudden death due to cardiac causes, I think there would probably have been some measures taken there to protect me. But I didn't know. So I just like to hit home the point of the importance of knowing your family history and sharing it. A lot of times, survivors especially, I don't quite understand it, but they'll be embarrassed to some degree.
A little shy.
A little shy about it, but there really is so much comfort and power in sharing your story with someone else, especially with someone else who can empathize with you. And with that comes this awareness that you can raise to other people. Because again, it all goes back to knowledge is power. You hear Dr. Glassberg saying, know your numbers, know your family history, ask your doctor these things. That's how we're going to make a difference.
So we can repeat again. I think it's very important for people to understand that you don't want your first symptom of a floppy heart muscle or an abnormal natural pacemaker or clogged arteries or whatever those common causes. You don't want your first symptom to be cardiac arrest and maybe not, leave this earth. But how does a person know? But if you have your family history, then the screening's easy peasy. It's a cardiogram and an echo. It's no needles. It's nothing invasive or painful. It's an ultrasound of your heart. How hard is that?
Yeah, so that's to elaborate on both of your point about the family history. You're right. People are sheepish because they don't exactly know what happened. And most people just say heart attack. Yep, I think my grandfather had a heart attack. My dad had a heart attack. And I bother to take it to the next level because once you hear a family history of someone having a true sudden cardiac arrest, the stakes are raised for that person sitting in front of you. So my question line goes, are you sure it was a heart attack? And I go into detail. Did they get to the heart? Did they get to the hospital? Did they diagnose the heart attack with the EKG and the cardiac enzymes? Did they do a catheterization? Or did that person collapse at home and die suddenly?
Yeah.
And that storyline sort of gets my
Triggers
attention
people.
a bit more.
Yeah.
They died, they collapsed. As soon as I hear someone collapsed at home, that's cardiac arrest until proven otherwise.
And we've talked about this on other shows, but it's like somebody comes to the emergency room where you have to see them after a trip and fall. Well, is it a trip and fall? Did they trip over the loose carpeting? And if so, they're more likely to have a broken wrist or some evidence that they tried to stop their own fall. If somebody falls on their face or head, chances are they had the arrhythmia, they blacked out, and then they fell without trying to protect themselves. And that's something you must go through all the time when you evaluate people pre-surgery. You ask those questions. That's a place, hey, you're going to have anesthesia, maybe for the first time in your life. What are the kinds of questions do you look for before you clear people for surgery?
So you're right. This comes up very often about the trip and fall or the came in with an injury. And, we're giving Matt a lot of grief outside this room. We gave him a lot of cute kudos in here, but we joke that the orthopedic surgeons just go fix the break. But you always want to know how they got that break.
Yeah.
So was it truly I tripped and fell, or did you have no warning and down you went? So one of my questions is, did you get hurt? How'd you fall? Do you remember? Did you have warning? Were you feeling dizzy or nauseous or feeling like you might be warned? And then were there any cardiac symptoms separate from that, whether palpitations or chest discomfort? So some of the history behind the fall can lead you to be more or less suspicious about whether or not that was an arrhythmia.
So symptoms that a person may need to be screened if they don't know their family history or there's something cooking. Episodes of fainting. We all like to say, oh, you fainted. Oh, you were nervous. It was hot. Well, we don't all faint when it's hot. So episodes of what we call syncope or palpitations that you were experiencing in college. Anything else that would bring, episodes of low blood pressure when you go in for a routine physical? What kind of things would people notice?
So that it was hot and you passed out, you fainted. There is a typical prodrome to that, right? I felt funny, I felt woozy, I felt hot and flushed. I knew I was going down. That's a little bit more reassuring than, I was walking along and boom, I woke up on the ground and I have no idea what happened. They're two totally different stories.
Mm-hmm, mm-hmm. Or though, could they feel woozy because they're starting to go into arrhythmia?
It's possible. So, I say when people come in to see me for syncope or that sort of loss of consciousness, I'll say there are a couple things that get my antennas up. Did you have no warning? Did you have any symptoms? Did it happen during exercise? Do you have any symptoms during exercise? Chest discomfort, dizziness, palpitations, shortness of breath. Did you get hurt? Where did you fall? Did you go down steps? Did you get right up? And how did you feel afterwards? I got sick to my stomach, usually more of that. Yeah, it was a hot, warm day and I didn't hydrate enough versus I woke up and I was fine. Not so typical. So, and then, as you said, the screening tests that I do, very reassuring, depending on that history, EKG and maybe an echo.
Mm-hmm. And an echo, again, it's an ultrasound of the heart. It's easy. It doesn't hurt. It gives us so much information about blood flow and heartbeat and strength and all those good parameters. So we talk about competitive athletes and we can talk about poor Damar Hamlin over and over again. But if you look at the video, they clip it off pretty quickly so you don't see what happens. But he gets hit in the chest by a fellow player's helmet. And we talked about this a little bit ago, about commotion in that heart. If you hit the exact right moment of sensitivity, anyone with a healthy heart can go out. So that was not going to be picked up on screening before his episode. But he gets hit, he stands up, and then you see him, and he starts to weeble wobble before he falls on the ground, which means he wasn't getting much flow to his head, and you could see him fall, and he fell on his head. And it's a perfect example of what we're describing. If you black out before you hit the ground, your fall pattern is going to be different than if you say, oops. Yeah.
Like you're trying to stop yourself. That's exactly right. And I was watching that game and my heart sunk when I saw the way he fell. And my colleague cardiologist friend called me and said, did you see that? And I said, yeah, that was the real deal. And it was the way he fell.
Yeah.
It was that sudden loss of consciousness before he even hit the ground. And there was no outreach or trying to stop
because he
his fall.
stood up after
Down
the
he
hit.
went.
He fell down, stood up, and then went through it again. It was really kind of chilling to watch that.
Yeah, we're really grateful for Damar for sharing his personal experience with that and supporting the Heart Association. So, unfortunately, it takes thousands watching it on TV to draw attention, but we've got our very own Stephanie Austin here sharing the exact same story. And, I'm just going to tip my hat to Stephanie for that because there are many, many people who are grateful inside and outside of the walls of the Heart Association for you being here today and for being alive and well and for being so generous with your story and your support.
Thank you.
And Stephanie, too. I'm sure you've thought about it from every angle, what happened to you and how you've handled it and moved on. But we talked about survivors being a little bit shy. Maybe they don't want to draw attention to themselves. Maybe they just want to move on.org and forget about it. Yeah. So extra kudos for being willing to relive it and tell it. But is it, I guess everybody handles it differently.
They do. And the one thing I share with women that I meet that go experience something, not even exactly what I did, because Thankfully, that's a smaller portion. But anyone that's had a stroke or a cardiovascular event, a heart attack, anything, it's a moment in your life, but it's a process and it takes time. Like I'm 16 years past my event now.
Wow.
So, but I would tell you the first 7 or 8 years, I really do mean that, 7 or 8 years was like a roller coaster, because you have moments where you feel fine and you have moments of insecurity because you've been brought to your most vulnerable state, and it's hard to shake that and to try to define your new normal and how you see yourself now, and to see these moments in your history as scars, but scars from which to be proud because you're still here and you can do something to help the next generation or the next woman you meet. And it's really, I say this all the time, but it takes a village, and it's going to impact cardiovascular disease, especially in women. But we can do it. We need to be empowered.
So how do we get people to recognize their symptoms? Go into schools, go into churches, communities. I know the American Heart is so involved with community efforts.
Yeah. I mean, there's lots of information out there to be had. This radio show is one of them. So lots of information on the radio, on the American Heart Association website. There's lots of very easy to read pieces of information about how to know what to look out for symptoms, how to do CPR, how to know your numbers, your risk factors, what to think about in your family history. So many, many resources that are available out there in all sorts of outlets for everyone's access.
And obesity is the new word that's prevalent. It's omnipresent. It definitely bumps the risk for multiple cancers as well. I mean, it's interesting when you make the point that women think heart disease is a man's problem. It's not a woman's disease. I'm GI Josephine. I've been doing GI since 1986 in practice. And you're right, women think mammogram and done. Pink is power color. And God bless Susan G. Komen for starting that. It was 1982. And blue didn't even become a thing till probably the mid-90s, because we didn't have the screening. More people die of colorectal cancer than breast cancer. Mm-hmm. That's men and women together, but it's not a contest. They're all important. And it's a hard sell to get women to, an echo, colonoscopy. Which would I rather do? Definitely colonoscopy.
More people die of cardiovascular disease than all cancers combined. And I know it's not a competition, but when it's that out of control,
I understand the
we
used
need
car
to do a better job.
You have to be a used car salesman to
Yes.
convince women that your heart is at risk.
Absolutely.
Mm-hmm.
And in addition to chime in on what Helene was saying, in addition to going on the AHA website to learn how to protect yourself and advocate for yourself and to trust your own body, because you know it better than anybody else. So if you, when you're at the doctor, don't be shy, make yourself heard, but also go on that American Heart Association website and learn hands-only CPR. It is so easy to do. And really just 2 steps. Call 911 and push hard and fast in the center of the chest. There is a Good Samaritan law that exists. So as long as you are acting in good faith, you are protected by that. And you're 2 to 3 times more likely to enable that person to survive by just doing hands-only CPR.
Good points. Let's take a little break, and when we come back, our wrap-up on this week's Your Radio Doctor. And welcome back to your final segment of Your Radio Doctor. We're learning so much. The take-home messages, we want to repeat them before the show is over. CPR, CPR, CPR. You see somebody who's down and out. Now, you don't want to CPR somebody who's sleeping. I just saw somebody on the internet who was reprimanded for that. That's probably not good form, but I shouldn't joke about it. CPR is so easy. And the Good Samaritan law, let's reiterate that you will not be held accountable if you're working in
Acting in good faith.
Good faith, yeah.
Yes, if acting in good faith, you are totally legally protected. And the bottom line is hands-only CPR increases survival 2 to 3 times. And also worth noting is that if someone requires CPR, they are dying. And the survival rate for an out-of-hospital cardiac arrest is less than 10%. So you really are their only chance if you are there. So as someone who benefited from the hands of CPR, I would encourage everyone to learn how to do it, because it truly is something that a middle schooler can do.
Yes. Yeah. And so the messages are CPR and call 911. Why not? That's what they're there for. I mean, you can't take your spouse or your loved one, or you're out in the street. You can't put them in the car and drive them and do CPR if they're still alert, if they're having a heart attack kind of thing. But CPR, and use your cell phone and put it on speaker so the dispatcher can instruct you a little bit, because you're going to be sweaty, even if you're, Dr. Kildare. I don't think most people know that is, but if you are, the stars from the show ER, you're going to be nervous because you never think it's going to happen to you. The one time I was on a plane, I fell asleep and I woke up and is there a doctor in the house? I'm like, oh gosh. And I was nervous, and the woman was quite heavy and she fell in the aisle. I had to step over the arms of the chairs to get over her, and we slid her up to the area where the potty is, so we had more space, and did CPR. And they said, why don't you just put her up in the chair and let her drink some juice? I'm like, you fly the plane and I'll do the CPR. No, I didn't say that, but in my head I did. And she was flat, and she came back, and then we landed and she didn't want to go to the hospital.
Oh my God.
Yeah.
Which was interesting. But
You make a good point about getting 911 on the phone to talk you through it, because while we're telling everyone learn CPR, while we encourage people to go take a formal class and get certified, learning it does not mean you have to do that. You don't have to pay for a class. You don't have to go there for hours. Get on the Heart Association's video. It's the easiest way to learn it, because at least then you've been a little prepared.
Yes.
And then you can call 911 and they're talking you through it, and you've seen it done in that 1-minute video.
And you're much less nervous if you have something in your toolkit. I know to do this. I know to do this. Yeah.
You can also order on the site, and for relatively inexpensive, I want to say there may be $25, $30 kits where it's a blow up mannequin. And I pull one out at Thanksgiving, at Christmas every year, so that the family can all practice.
It's awesome.
Because there's something to be said about muscle memory, and it gives you a sense of how hard to push. But having said that, you'd rather push too hard than too soft. You'd rather do it than not do it. So at the end of the day.
And you bring up a good point. I always tell, whether I'm trying to get family history for cancer or heart disease or whatever the issue, Thanksgiving is a great time. People are a lot less formal than we used to be, and more outspoken, I should say. So, there's nothing, to be embarrassed about when we're talking about heart disease. Colon kind of stuff, maybe a little bit, but heart disease. Did anybody die at a young age, drowning, those kind of things, fall asleep at the wheel? Go Red for Women. Let's talk about some of the details. We have about 6 minutes left.
Yeah, Go Red for Women. So we have a very active group here in Philadelphia leading Go Red for Women. And our main goal is to educate and advocate and empower the women in our community to lead longer and healthier lives. And, a lot of what we talk about when we get together really is, in addition to knowing your family history and knowing your numbers, is about trusting your body and trusting yourself and finding the support of others. And listen, life is not easy, and it gets to all of us. And, sleep plays a role, and stress level plays a role. All of these things impact your heart. So we are working to do that. We have a fundraising campaign. Within that the fundraising campaign really culminates in our event that will be May 21st of this year at the Bellevue. And we have a lot of corporate sponsors that are gracious enough to want to support the amazing efforts we're supporting here in Philadelphia. And also in that campaign, you may be familiar with a little sub-campaign, not so little, called Women of Impact, of which I believe you are one. And our Women of Impact leaders, which I think we have maybe the most in the country, actually, in Philadelphia, or one or two in the country. And
we're the most fun ones.
We are definitely the most fun ones. And these women, like yourself, Marianne, are highlighting these causes, as you are doing in this show, and raising the critical funds, because none of this can happen without financial support. So it is what it is. But again, to make a difference, that's what's required.
Well, and I want to highlight another little fun thing that Helene just did. I'm using that seriously. Awesome thing Helene just did. The American Heart Association on February 4th, is that like is the 4th a certain day that's
Go
significant?
Red. It's the kickoff for Go Red.
The first Friday in February.
Well, the first Friday. Oh, this year it landed on. The first Fridays always go where
we
red.
bumped it. I
But-
think we bumped it because I hate to say.
Right.
birds.
Well,
Go birds.
people in Philadelphia were saying you can't wear red. Then others will assume you're cheering for the Chiefs. That said, we're going to highlight. I'm glad you brought that up. February 18th, we're going to relive Go 19th. 19th, yes. February 19th, 1/9, February 19th, wear red all day, wear red underwear, red jammies,
We'll take any of it.
llama, red pajama, wear red eyeshadow, red lipstick, red, because it is the number one cause of death in U.S. adults. Heart disease, And so that said, Philadelphia is part of the country, the number one cause of death in Philadelphia. And so you and American Heart Association staff went to City Hall. Tell us about that on February 4th.
That was really, really cool. It was Advocacy Day.
Yes.
And several city councilmen joined us to hear us out on the big subjects of involving heart disease and the risks for heart disease, especially as it pertains to our city. So along the lines of, we talked about the poor statistics with CPR and cardiac arrest survival. We really hit home on things like risk factors like hypertension and nutritional insecurities. And the Councilman Harity, he co-sponsored the event, and he shared his own very
I heard that.
literally heartwarming story about his personal experiences and fight with heart disease. So it was really a tremendous advocacy day.
So, and I know there were other people that shared their personal stories. A third of the people in Philadelphia, at least a third of the people have high blood pressure, which is one of those things that can be tricky, but it's treatable. And if you go along and say, I feel fine, I don't need to see a doctor, everybody needs to have a yearly physical, everyone, no matter how great you feel. There are so many conditions, diseases that are without symptoms, and you're really just cheating yourself. Philly food bucks, removing barriers to self-monitor blood pressure machines. All those things were discussed at Heart Month at City Hall Day, yes?
Yes.
And healthier children's meals. I just wonder how our country became so overweight. I mean, we look at, because it influences so many GI conditions. Fatty liver is like the blob eating the diner. It's no longer Hep C and other liver conditions leading to liver transplant. Fat in the liver.
Yeah.
And we can detect it again with ultrasound. So how can listeners get involved?
Get another reason to get on the American Heart Association site. I think all this information and how to channel your interests and efforts and support can be found on the Heart Association site. Speak out to your city councilman. They will listen, and they listen to us. And these are really important subjects to get involved in, to support things like, balancing out nutritional insecurities, a real big problem in this city. We have a lot of food deserts and food swamps, as we call them. And these are barriers we need to address and overcome.
For our listeners, meaning neighborhoods where there's a corner deli that sells chips and all, but not fruit and veggies. And it's hard to try to live up to the recommendations. Final say how people get involved or visit. I want people to look at your story.
I would love that. My story you can actually find it on YouTube under Faces of Heart, Stephanie
Faces
Austin.
of Heart. Okay.
And go on the American Heart Association website. Call the American Heart Association, and I think will you provide that number?
The number is 215-575-5200, and we'll put that in our newsletter and put it on yourradiodoctor.net. I want to thank you both, my new BFFs, my sisters of the heart, Stephanie Austin, superstar, and Dr. Helene Glassberg, saving so many lives, both of you. I'm really privileged to know you both, and I'll do my best to be a woman of impact and raise dollars. But anybody who wants to donate their time, talent, or treasure, American Heart Association at heart.org.
Join us.
And thank you for our audience for joining us today. Thank you for listening to Your Radio Doctor every Saturday at 5 here on Talk Radio 1210 WPHT. Listen to all of our shows at your convenience on Odyssey.com, AUDACY.com. And now, watch every one of our shows on YouTube. Just search Your Radio Doctor, and please subscribe to our YouTube channel. It's free, it's easy. Go to YouTube and search Your Radio Doctor and click on subscribe. Thanks to our exclusive sponsor, Independence Blue Cross, for their continued support. And as our listenership continues to grow, we invite you to be a partner as a sponsor. We'll help to share your message. Contact me through email at info@yourradiodoctor.net, info@yourradiodoctor.net. February is Heart Month. We celebrate Valentine's, and we work hard to form a community with healthy hearts. So I want to thank my friends at the American Heart Association for helping coordinate today's show. I want to thank Stephanie Austin, the super ambassador for the American Heart Association, and Dr. Helene Glassberg from Penn Medicine, saving lives on a daily basis. You can visit our website, yourradiodoctor.net, and learn how you can support their efforts with their many initiatives, including Go Red for Women. We love men too, but women sell themselves short. And help fight heart disease in your mothers and wives and sisters and grannies and daughters and all the beautiful women in your lives. We continue to pray for peace in our world, in our beloved country, in our families, and in each of our own hearts. This is your Radio Doctor, Dr. Marianne Ritchie, sending you all my love and hugs and kisses during February and every month. Wishing you a happy, healthy, and safe week with the ones you love, and always here to remind you that your health is your wealth.
Thanks for listening to your Radio Doctor, Dr. Marianne Ritchie, presented exclusively by Independence Blue Cross. To contact Dr. Marianne and to listen to today's show as well as past shows, visit yourradiodoctor.com.